Hi, welcome to SYNAPSE Talks from SYNAPSE U of T. In this podcast, we chat with people about their work, careers, and insights within the incredible discipline of neuroscience. In this episode, Christy and Zara meet with Dr. Asif Doja, a pediatric neurologist. We filmed this episode in January 2022, so some references may be outdated. However, we are confident that the ideas in our conversations are timeless. Enjoy!
Alright, hi there everyone. Welcome to SYNAPSE Talks. This is a podcast where we sit down and chat with neuroscience professionals to learn a little bit more about their work and their lives. I'm Zara.
And I'm Christy.
And today we're with
Dr. Asif Doja.
Yeah, so excited to have you on. Dr. Doja is a pediatric neurologist and serves as the director of the Movement Disorder Clinic at the Children's Hospital of Eastern Ontario. He is also an associate professor at the University of Ottawa. And fun fact, he's a fellow podcaster and hosts Doctor versus Comedian, where he dissects medical topics alongside comedian Ali Hassan.
Yes, it is indeed an honor to have Doctor, Associate Professor, and fellow podcaster, Dr. Asif Doja here with us today. How are you doing today?
Good. Thanks so much for having me.
No, it's an honor. So I guess let's get right into it. Simplest way to go forward. What is pediatric neurology, and could you describe what kind of work it is you do?
Sure. Pediatric neurology is the medical study and treatment of brain disorders. It's the thing we usually have to say at the beginning is, first of all, we're not surgeons, and so we don't do any surgery. So it's medical treatment of those kind of disorders. And again, we're just pediatrics. So birth to 18 years is what we would see in Canada as a pediatric neurologist. Then after that, it would be an adult.
Yeah, so the specialization is really with children, teens, young people then.
Correct.
Yeah. And considering the work that you do in your particular department, a lot of it focuses on movement disorders, right? Mm-hmm. And a lot of our listeners, especially being undergrad or entry level, they might not be quite that familiar with movement disorders. Could you give us an overview on the different types of movement disorders?
Sure. There's many different areas of neurology. In pediatric neurology, probably epilepsy, developmental delay, headache are the main things that people see, but you can have areas of subspecialization in pediatric neurology, so sort of less common disorders. And so that's an area of interest that I have, which is in movement disorders. So movement disorders would be really, as the name implies, any sort of abnormal movements caused by a neurologic disease. So what would that be? In adults, it would probably be something like Parkinsonism and Parkinson's disease. In children, though, that's not very common. So what we see in children most often is like tics or Tourette syndrome. That would be the most common movement disorder. And then there's other more rare disorders that can cause other kinds of abnormal movements, but those are much less common.
Right. So it's still quite a varied field, even though you're working with like a specific age group then.
Mm-hmm. Yeah, exactly. Yeah. And you can see different presentations of disease depending on the age, because, as you guys know, the brain is always maturing and developing over time. So that's why you have to also know not only what diseases can be present, but what ages that they can be present in, because certain things would never occur in a baby, like tics and Tourette syndrome doesn't occur in a baby, but more likely to occur in an older child.
I see. So the developmental aspect, is that something that particularly drew you to movement disorders, particularly in children, the development of it all?
Yeah, I think definitely for movement disorders, and even just the reasons why I went to pediatric neurology in general is because you get to deal with kids and you get to see them over time. And as just as you were saying, like the differential diagnosis for what the patients may have as their underlying condition, it differs depending on the age. So it's kind of exciting to have to kind of learn new information for these different areas and apply it differently depending on how old the child is.
Right. It's like watching something change over time. That's exciting. As a scientist, something growing.
Yeah, that actually sounds so cool. I'm sure you've come across so many kids, so many patients. Is there something maybe that stuck with you, some memorable moment or unexpected case that you came across that's just been with you for your entire career?
Well, I mean, I obviously can't mention specific cases, but the best thing about neurology, especially pediatric neurology, is that things evolve over time, and we know a lot. I mean, I'm not trying to denigrate other systems, but you guys are neuroscientists, so you guys know the brain and the nervous system is the most interesting system in the body, and I think we know quite a bit about the other systems, but the brain especially we still don't know enough about. So I'll give you just one example of something you guys have probably heard of now, but when I was training, back when I was doing my residency in the early 2000s, nobody knew of this disorder, which is something called anti-NMDA receptor encephalitis. And so what this does, it's an autoimmune attack on the brain. And now, of course, everybody knows about antibodies and immune systems and stuff like that because of COVID. But it's an autoimmune attack on the brain that attacks the NMDA receptor. And that will cause something that looks like an encephalitis or an inflammation of the brain, which is usually due to a virus, but this time it's an autoimmune phenomenon. And the patients present, though, with psychiatric symptoms. And so you can think that patients are just having a psychosis or some sort of unknown thing. And when I was training, this disease didn't exist. And then over time, it was discovered by a physician who was in the U.S., in Philadelphia, now is in Barcelona, named Joseph Dalmau. And he kind of discovered this disease and described it for the first time. And this whole idea of autoimmune and neurology, though we have some autoimmune disorders like multiple sclerosis and things like that, the idea of this autoimmune attack on the brain causing seizures and psychosis was kind of a new area. And in fact, the first patient that was diagnosed in Canada, we diagnosed at our institution, and it just happened that I happened to email Dr. Dalmau because I didn't know what was going on with this patient, and he said, "Oh, I think it's this disease." He didn't say that he discovered, but he did. And he said, "You should test for it. Send me the samples and I'll do the testing." And we did. So, that's just a fortuitous thing, but it just goes to show how things can evolve all the time. You're constantly learning in the neurosciences, which is the reason why I like it so much.
That is incredible. It's like a movie.
And of course, they did make a movie out of that. The movie's called Brain on Fire. Not about me, but because there was a reporter in New York who had it, and it's about her kind of life, and she wrote a book about it. And so you guys can look it up. I think it's on Netflix.
Brain on Fire. We'll keep that in mind.
Yeah, for sure. Yeah, so I think on this topic of like how neuroscience is just it's such like an elusive science too. There's so many things always changing and evolving. And I think, we read some of your research, and one that really stuck out to us was the article on neurophobia, something I actually never heard of before, but correct me if I'm wrong, it's just the fear of neurosciences.
Yeah, and especially in medical school, the fear of neurology, as a specialty. And of course, it's maybe foreign to you guys because you guys are interested in neuroscience. But, for other people, whether they're doing physiology or, again, in medicine, there's this real intimidation factor to the neuroscience. Yeah.
So do you think, I think the article was published in 2014, so it's been a while. And obviously a lot has changed. The pandemic has kind of put the medical field in general in the spotlight. Do you think maybe neurophobia, how medical students perceive neuroscience and science in general has changed because of maybe the pandemic? They're seeing science as more of the empathetic version of science where it's saving people rather than focusing on the difficulty.
That's an interesting way of putting it, and that's probably the most positive spin that you can put on it. I don't think so, though. If I'm being cynical about it, I think that first of all, you have people who are more distrustful for the medical establishment. It seems, though it's probably not true, it seems there's just as many people who are pro-medicine as anti-medicine, but that maybe just what's perpetrated in the media and social. But I think. I wouldn't say neurology and pediatric neurology has come to the forefront because though we can see complications from COVID in neurology, it's not that common. But I do think there are people who are really getting their due and respect, and those would be infectious disease doctors and epidemiologists. Because if you think about it, nobody even knew I don't think what an epidemiologist was, like 2 years ago. I just saw something on social media that someone got a mug who's an epidemiologist, and it says, "Make epidemiology boring again," because they were happy being boring and uninteresting. And now, everybody's talking about epidemiology, so I think it has done a lot. I think you will see more people maybe going to those fields, infectious disease, epidemiology, virology, and maybe some neuro aspects of that. But I think those would be the ones kind of more interested in.
How about this perception? If we're talking about, cynicism, how about this perception of neurophysicians possibly being unhappy? In this pandemic, I'm sure that you and your colleagues are under more stress than ever, as is a lot of the world. Do you think this has changed at all with the pandemic? Do people see neurophysicians as even unhappier?
Yeah, that's a good question. And, if you look at people who are burnt out in medicine, so burnout is the actual term, and emergency physicians and neurologists and internal medicine specialists are at the highest risk of burnout. So, but those are corollaries, right? Burnout and cynicism are related to each other. And so I do think we're seeing that not just in neurology, but in all physicians is burnt out. I think there are many reasons for physician burnout that are historical over time. But I think, as you're saying, the pandemic has made it worse because of the overall stress. As I always tell my patients, I ask them if they're stressed and they say no. And I say, well, that's weird because, there's 7 billion people in the world who are stressed right now. Because, everybody is stressed. You can't plan your life 2 weeks in advance, right? Because things are changing. And so, but I do think it's even more for medicine. And again, there are some specialties that are already at risk of burnout. And then, perhaps even more because of the stress of the pandemic. And of course, when you have, again, it's a small group of people who are kind of speaking out against the medical establishment, that I think can contribute to kind of some of these feelings of cynicism.
This cynicism, I'm with professionals who are already in the field, like that, it seems to be quite prevalent now from this conversation that we're having. But how about for some medical students who are still studying, who are looking for more permanent placements in the field itself? Do you have any advice for them if they feel like they're losing motivation, losing empathy for the clinical work in neurology?
Yeah, that's a really good question. And we did a paper on this looking at kind of student discussion groups and this idea of empathy changing over time. And one thing, unfortunately, that happens is people who go into medicine, often want to help people and they're altruistic. But then as time goes on in medical school, and this has been well described over time in various studies, that the cynicism kind of gets worse over time as you progress through medicine. So you start off idealistic and you become cynical by the end. And I think that's because of a lot of the things that are stressors on the system. And so I mean, like, not your personal system, but the hospital medical system and those kind of stressors. And I think the main thing that people can do, and this is my advice for people who are interested in medicine. So even before you go into medicine, you should think about why you want to go into medicine. And unfortunately, and this is going to sound, you probably will think I'm being cynical, but I think it's just more realistic, because any job that you do, you need to have some you should have a feeling of success and satisfaction just by doing that job. But in medicine, sometimes people go into it for the wrong reasons. They go into it to make money. There's many other things you can do to make money. You guys know how much tuition right these days, and especially for medical students. So you'll come out negative for quite a long time if you go into it to make money. And even to say that you're going into medicine to help people, it's not, because you can't help everybody. And I think that's, a lot of people go in with altruism, and it's difficult. So the best reason to go into medicine, in my opinion, is because you love the study of medicine. You love seeing patients. You love trying to figure out what's going on. For us, it's, you find the brain and neuroscience fascinating, and that's why you go into it. I think those people who go into medicine for those reasons will be more fulfilled in the end and can kind of counteract that cynicism.
So sort of keeping that internal motivation over external motivation, that gives you a bit of resilience in your experience.
Absolutely. Yeah, see, you said it better.
No.
You said it better in 2 lines than I said in 5 minutes. So
I'm just picking words from my brain, from the content you've given me. I think that's a really, really heavy and important piece of advice to keep in mind. It's so easy to get distracted by external factors, pay, helping others, doing this, doing that, solving, winning Nobel Prizes. That's a lot of pressure that a lot of, especially medical students, people who work in science, I find from talking to other classmates, they're very idealistic and they have very high expectations of what they're going to do, because a lot of them are smart. Most of them are smart people. They want to do big things. And I think what you've done is given them a very great piece of grounding advice to keep that internal fire burning. Yeah. All right. Well, we've spoken a bit about internal relationships, how you feel, how a person would feel about themselves working in neuroscience. I'm curious about the relationships between teachers and students. Now, when me and Zara were looking through some of the literature that you've been involved with, we noticed that you were involved in a study that looked at the role of nurses and their relationships with the medical students they were mentoring. And so it was interesting to us that we picked up on how interdependent this relationship seemed to be, that the amount of effort that a nurse would bring to the table seemed to depend on how much the student would be engaged with the work they were doing. And also that how responsive the student was to the nurse seemed to be mediated almost by the nurse's attitude towards them. And to bring up the pandemic again, do you think this pandemic actually has weakened this type of mentor and mentoree relationship, or has it actually brought the community tighter together than ever?
Yeah, I mean that's a really good question, and I think it is tough. And I think this virtual, the virtual stuff is bad in a lot of ways. It's good in some ways. For example, would this podcast have been as easy to set up, other than just you sending me a Zoom link than it was, a year or two ago? Probably not. So that's so there are a lot of negative things, and I think that is one of the things you hit upon. At least with nurses and students, they interact with them on the ward when they're doing their clinical rotations in medical school or in residency. So you have to be in the hospital for those rotations. They're not going to be remote like this. And so they will get that one-on-one thing. But in terms of us, as in the physicians interacting with students, it's a lot less, right? The lectures we give are all virtual. And, they've moved a lot to some people may attend your live lecture, but can you just record it and then they'll just download it when they get a chance and watch it later? And so that kind of interpersonal thing, it's not the same, I find. And so that, I think could have maybe some downstream effects that maybe we're not thinking about, right? Because as you implied, you often go into a field, whether it's neuroscience, pediatric neurology, any kind of field, because you have experiences with either mentors or role models or things like that. But if you don't have that relation, then it might be a negative thing. So yeah, it's definitely at risk, I think, because of the pandemic. There's
consequences for that type of thing in terms of where the field could be going, right? Like how a student could be performing further down the line when they're actually physicians.
Yeah, that is a good point. Like, what are the long-term ramifications of that? And people are worried about that right now, right? Like, even with younger kids, elementary school kids, if they're just online all the time, they are online. I mean, that's what social media is. But now they're online for their school too. Like, how are they going to be able to interact, when we're in the real world, they say. So, yeah, definitely. And I think we have to think about it at all levels. Young kids, older kids, and then people who are in their training, whether it's undergrad, postgrad.
No, definitely. I see what you mean about it applying to many different levels of education. Well, just to expand a little bit more outside of just people who are working directly in the field, so maybe people who are in the general public, let's move away a little bit from the pandemic and let's talk about your actual field of movement disorders. Zara, I know that you're doing a co-op internship or a position right now with, working in a different environment that's not just within the academic area. So I know that you have something that you wanted to ask about general media.
Yeah. So I think especially on this topic of everything being online now, like everyone is always online. You're always getting your information from the internet, and it's kind of, you're losing that human interaction. And, students are learning from YouTube instead of doctors, let's say. So in the sense that we're learning a lot about the medical sciences through social media and movies. And for example, right now, Tourette has come back into social media and everyone's learning about that through the media. So how have you seen, let's say, movement disorders being portrayed in the media versus what the reality of patients with movement disorders is really like. Like, is there a disconnect?
Yeah, and because we've done a couple of studies looking at the portrayal specifically of Tourette syndrome on YouTube and on in movies and TV shows and things like that, and it's usually a negative portrayal, kind of making fun of people, and and there are a few educational things, but they're not the majority. Most people have like seen something on The Simpsons or South Park or on YouTube, these Tourette guy videos and things that are quite derogatory to people with Tourette syndrome. But that was a few years ago. But as you mentioned, there's something very interesting that's happened over the pandemic. And you guys are younger than me. A spoiler, you guys are much younger than me, so you guys are probably more in tune with this. But especially on TikTok, there's lots of people with Tourette syndrome who are coming to attention and becoming social media personalities with millions of followers, and they have their tics, and that's just kind of the way they are. And so in that sense, it's really a positive thing because there are some positive role models out there. It's not embarrassing for kids anymore, and the kids I see are seeing that. So that's really amazing. And of course, with every pro, there's often a con. The other thing that's going on, and we have a podcast episode where we talked about this, and a lot of my colleagues are in Canada are studying this right now. There's also a lot of people with what we call functional tics or Tourette's, or the other word is psychogenic, right? So they don't have inherent tics or Tourette syndrome, but they're developing it kind of as what we call, the other word for it is conversion disorder. These are movements that are related more to like an underlying stress or something like that, as opposed to actual tics or Tourette syndrome. And they're also that's also occurring on social media as well. So now it's hard to know, and in fact they're seeing that there's a spread of these functional or psychogenic type tics worldwide that's increased, and the theory is that social media is kind of contributing to that. So that's a con. But then on the other side, if you go back to the pros, it's also a good thing because I've even had some patients say, "Oh, I think I have this functional or psychogenic disorder," and I say, "How did you know that?" They're like, "I saw that on social media, so that's what I think I have." And I've never had people come up with that diagnosis. It's the first time it's ever happened to us this year, and I think it's because of social media. So it's a pendulum swinging back and forth. There's good things, there's bad things, but maybe there's also some good things as well.
Yeah, actually, on the topic of Tourette's, just out of curiosity, like, can you kind of give us a breakdown of how Tourette's actually affects the brain, like what's going on in very like lay terms, what's going on in the brain with someone with Tourette's?
It's tough, Zara, because you're asking a question that people don't know the answer to, but what they think is it's a disorder of inhibition. So with tics, you have an urge to do a movement, and then you do the movement and you feel better. So it involves pathways that connect the basal ganglia, which, most people listening to the podcast probably know. So the deeper areas of the brain that are involved in a lot of things, but mainly motor function and motor control, and they connect to these frontal basal ganglia type circuits. So going back to the front part of the brain, which the frontal lobes often control inhibition and motor movement and sometimes premotor planning and things like that. And it's these connections going back and forth, but it's an inability to inhibit behavior actually the problem. And so that's probably, to simplify things, probably the most we know right now. We also know that it's developmental, as we said, occurs in certain ages. So it starts around 4 or 5, worse between ages 10 through 12, and then improves afterwards. So it's also, we know that it's not a permanent problem, but it can improve over time.
Interesting. So we wanted to also talk about, we know that you do some research on just case studies rather than like looking at large participant groups. As a university student, most of the studies that we work off of are participant studies, clinical trials, and stuff like that. So we don't really get exposure to single case studies. And the fact that you work with case studies, maybe just kind of give us an insight of what it's like to work with case studies versus larger participant studies. Are there like challenges or something that is different between the two that It's interesting.
Yeah, I mean, it's a good question. And so a lot of those are things that I often do with like medical students or trainees if they see an interesting case that they want to kind of write up. So the key for a case study is it should be something unique that's adding to the scientific literature. And some people look down on case studies because they're like, well, who cares? It's that one patient. But that one unique patient may spur a case series and then may, as you're saying, spur a prospective trial. So you have to start somewhere in terms of trying to add to the information. And it's usually just describing, as you said, one patient who may have an interesting finding, an interesting presentation, maybe an interesting diagnosis. And it just makes people think, oh, I should think about this in this situation. And so, I mean, the main thing is you need to get consent. Nowadays, you definitely need consent from the family to publish their case report. I've never heard of a family who wasn't interested in doing it. They usually want to hear what other people have to say, and often once it's published, then I give them a copy of the report. And I'm like, oh, here you go, and then they have that kind of for future use if they're seeing different physicians and things like that. I think people just like contributing to the medical literature, as in the families and the kids. So most people have been really good about it and are happy to kind of help expand science even with these small.
Yeah, no, that's definitely, because I know it's also been like there's a show on Netflix, I don't know if anyone knows it, Diagnosis, and it's looking at specific case studies in neuroscience, and it's just really interesting to see things that you don't see in bigger participant research just because the cases are so different and unexpected. So yeah, it must be really interesting to work with case studies.
Yeah. That relationship must be more personal between the researcher and the actual, because you're working with a much smaller number of participants, maybe even just one or two then. Yeah.
Yeah, and you know them personally. They're almost always your patient.
Yeah.
And that's why you decide to write it up. And so, yeah, and like I said, it's usually families are very willing to do it and to participate because also raise awareness. What if they have a really rare disease, right? And maybe there's somebody else out there who just, they're trying to figure out what their child has. And, why would you not want to agree to that? So they've been really great.
Yeah, could be a very interesting and useful launching pad for even more research in the future. Mm-hmm. Yeah. So we've spoken a lot about a lot of your current work. Let's cast your mind back, allow us to cast your mind back a little bit back to school days. So it's January, undergrads are starting school again. We'd like to ask you about your postgrad experiences. Now, we know that you completed a postgrad experience at the Sick Kids Hospital. Now, what was that like? What would you be doing on a daily basis? And if there's any University of Toronto or any undergrads out there who are looking for a similar experience at Sick Kids, what advice can you give them?
Well, so I went there for residency, so I was there between 2000 and 2005, and in medical school, you can apply. There's a couple ways to do pediatric neurology. You could apply to general pediatrics and then subspecialize in pediatric neurology, but more and more there are these specialized residency programs for pediatrics. When I was in med school, there was only one, and it was the one at the University of Toronto. And so that's where I went for that residency program. Now there's like many across the country where you can choose where you want to do that treatment. But when you start off doing a year or so of general pediatrics to kind of just get used to seeing children and doing rotations in that. Then you would move to doing adult neurology. So you do adult neurology for 6 months because you need to kind of, in adults, because their nervous system is not developing anymore, it's relatively fixed, right? After 20s, it's relatively fixed. Then you're kind of getting the concrete neuroanatomy, right? It's not going to change in a given person.
Right.
So you kind of get that down. You get really good at what we call localization. So localization is a key thing in neurology where somebody presents with weakness on one side or vision loss or something like that, and you using your knowledge of the nervous system, you localize where the problem is, and then you can figure out so that's a key point of it. So that would really, you learn that during adult neurology, and adult neurologists are amazing at it. And then you do rotations in people. So you see patients on the ward who are admitted to the hospital. You see patients who are coming for like an outpatient visit to the clinic. You go to different areas in Toronto. You will sometimes go to Holland Bloorview, the pediatric rehab center, and then you learn other things. So you do some subspecialized rotations in epilepsy, in muscle disease, to kind of get a very well-rounded kind of exposure. And then at the end, that's 5 years. At the end of 5 years, you write an exam, and then you hope you pass, and you go and start practicing.
Lots of experience, though. Like, you do a lot of different rotations, even with adult and children, and then you also have epilepsy work and a lot. That's quite a rich experience. And if we're talking about other postgrad experiences that you've had, we know that you've also completed a Master's of Education. Now, that's quite a path that some other people might not choose. Some people might go into other fields. But do you think it's given you a perspective of neuroscience that's particularly different from some other people in your field? Or how would you describe that perspective?
Yeah, I think so. And so, as you kind of alluding to in the interview, I do neurology and some neurology research, as you guys had said, but then I do a lot of research in the medical education, because that's where the neurophobia, the studies on cynicism has come from. And so, because I was interested in how people learn, I did this master's in education during my residency and then completed it 2 years afterwards. I just did it part-time, about 4 or 5 years or so. And I think the main thing is, I think it's very interesting in terms of looking at how people learn in neurology, and really that neurophobia stuff was very interesting to me, in terms of you have to make sure that you want to try and give your fascination, right, and what makes you so interested in neurology and the neuroscience. You want to try and impart that to other people. And obviously, as we talked about with the neurophobia, it's daunting, right? Neuroscience is huge. We don't know enough about the brain. And so people can get scared of that. But I think if you can communicate your passion to them and how much you're interested in. So I kind of realized that, like, that learning aspect is really kind of rooted in that, making people understand why you're so passionate about something.
Yeah, communicating that passion. And the beauty of neuroscience seems to be, so again, just talking about the internal passion and internal motivation to keep going in this field. That seems to be something that's quite important to you then, communicating how beautiful neuroscience is. And we were wondering, actually, with your podcast, it takes quite heavy medical topics, sometimes related to neuroscience, sometimes related to other things, but it ultimately dilutes it with another perspective, some comedy, some pop culture talk. So is that where the idea of all of that came from? Just being able to communicate how beautiful medicine and science really is?
That's a really good way of putting it. So that was perfect, Christy, because that's basically what it was. And so, I've done a lot of research and published in different things, and you guys have talked about a lot of it. But it's exactly what you said. You have this desire to communicate to the average person, right? Because when we communicate in science, sometimes it goes out and, you get a story that's picked up by the press or something like that, but usually just communicating to other science, which is fine. But there are a finite number of scientists, even though neuroscience is a huge field, and neurology and pediatric neurology, smaller fields, but it's still communicating to that finite audience. But there's so many people in the world, there's billions of the people in the world who may be interested in this. And as you were talking about, it's how you can communicate some of these concepts to people in just a simplified way. So we're not using fancy language and confusing terms, but in a way that everybody can understand. Because when you are able to tell a story, like the story I told you about the patient with the anti-N receptor encephalitis, that's an interesting story, right? You could tell that to your friend, when you're having coffee with them, they're like, oh, that's really interesting, even if they have no experience in medicine. So you're absolutely right. That was part of the thing that I was interested in doing, is communicating that. So as you said, a lot of the topics we pick are neuroscience, brain related, and even if they're not quite neurology, what I do, it may be something like cannabis, and its effects on the brain and how it's being used, or something like psychiatry, like OCD. So I'm not a psychiatrist, know enough about OCD and how the brain works with. And then, of course, my co-host is a stand-up comedian, and as Christy implied, the other interest I have, I like pop culture and movies and entertainment and TV and things like that, and I also like talking about that. But nobody probably really wants to hear me talk about those things, right? Because I'm not an expert. So I thought, well, let's combine comedy and entertainment with medicine, and we can each talk about these different topics. And so, as Zara kind of alluded to, every episode, like, I ask him an entertainment question, and we talk about that for 15 minutes, and then he'll ask me a medical question, we talk about it. But yeah, really, it was rooted in this desire to be able to talk about these topics, not just to people in the scientific field, but to just the average.
Yeah, start communicating how fun it can actually be, and without some scary medical terms, anatomical diagrams everywhere, Yeah, exactly. I think me and Zara could both agree on that it's fun to talk about neuroscience with other neuroscience students, but it's even more fun to talk about it with English students, English majors, math majors, everything majors, Yeah. Oh, yeah.
Yeah, so that's actually all the questions that we had for you. We're so excited and happy that we got the time to speak with you, and we learned a lot. I learned a lot. It was a lot of fun. Yeah. So I did want to just, before we end off, just kind of get last words of advice. So if we were to say that, let's say your child came up to you and said, "Dad, I want to be a neuroscientist," what's the biggest piece of advice that you would give them?
Wow, that's a good question. I think just is what we talked about before. Just follow your passion. As long as you feel that you're fulfilled by what you're doing, then the sky's the limit. I think neuroscience is a very good field to go into because, as we talked about many times today, it's constantly growing. It's so exciting in terms of where it can go and how little we know. So the field's endless. And I think if people are interested, Christy kind of asked this before and I forgot to answer her question, but if people are interested in doing more work, especially pediatric neurosciences and pediatric neurology, for you guys, as you said, you guys are based in Toronto, and there's a lot of good researchers, both basic science researchers and clinical researchers at Sick Kids Hospital. So I'd just be on the lookout for people. The best way to kind of know if that's what you want to do is look around, see if there's any summer student opportunities. I think those are perfect for you guys, people at your level. See if there's any summer student opportunities to get you some exposure, because even if you're working in a lab, say at Sick Kids Hospital, you still will hear about patients and get that clinical exposure. And if that's what interests you, and if you want to go into medicine, that's great, but maybe you want to go into something else, right? Maybe you want to do further research, but with a pediatric neurosciences lens, which is even better. So I think try and get in to that, to keep an eye out for summer studentships, because I think that's a good foot in the door for everybody who may be.
Yeah, so stay engaged mostly then. Stay engaged with the neuroscience. Yeah. Well, it's been wonderful having you here, Dr. Doja. It really has been. You've given us a lot of great advice. And, it's really inspiring to see someone who's working in the pandemic and working in this field who has such a core focus on keeping passion alive and also just communicating science to every layperson with humor, And so shout out to Doctor versus Comedian. It's on Spotify. It's very funny, high quality podcast. Hope that Synapse Talks can reach its levels one day. And to all our viewers, thank you for tuning in, and stay tuned for our next episode, which is sure to come out whenever we finish editing it. Thank you, Dr. Doja. It's been wonderful.
Thank you.
That's it for today, folks. Thank you for listening. We hope you enjoyed this episode of Synapse Talks by Synapse U of T. By the way, the marvelous music that plays at the start and end of the episode is called Arcade by Artur Aravidi. It is licensed under an Attribution Non-Commercial 4.0 International License from Creative Commons. You can access this music at freemusicarchive.org. And if you want to hear more episodes of Synapse Talks, you can visit our website at synapse.sa.utoronto.ca. That's synapse.sa.utoronto.ca. Bye for now.